Question 1. The review process indicates that a behavior analyst has identified a promising new intervention for severe problem behavior in a recent peer-reviewed journal article. The article reports significant positive outcomes with a population that shares some demographic similarities with the analyst's current client. But the intervention is not yet widely adopted or discussed in standard clinical practice. The analyst is considering how to best integrate this finding into their practice for the client. Which of the following represents the most ethically sound and professionally responsible approach? Option A. Implement the intervention based on the published article, but only after seeking informal advice from colleagues who have also read the article, without a formal assessment of the client's specific needs or guardian consent. Option B. Dismiss the intervention as too novel and not yet proven in widespread practice, and continue with the current established interventions. Option C. Conduct a thorough literature search to identify any other relevant research on the intervention. Critically evaluate the methodology and findings of the published study. Assess the client's specific needs and the feasibility of implementing the intervention in their unique environment. And discuss the potential benefits and risks with the client's guardian before proceeding. Option D. Immediately implement the new intervention with the client, as the published research demonstrates its effectiveness and the client's problem behavior is severe. Correct answer is C. Conduct a thorough literature search to identify any other relevant research on the intervention. Critically evaluate the methodology and findings of the published study. Assess the client's specific needs and the feasibility of implementing the intervention in their unique environment. And discuss the potential benefits and risks with the client's guardian before proceeding. Explanation. The review process indicates a common challenge in applied behavior analysis: the gap between published research and practical implementation. This scenario is professionally challenging because it requires a behavior analyst to balance the imperative to use evidence-based practices with the realities of client needs, resource constraints, and the ethical obligation to provide effective services. The analyst must critically evaluate the applicability of research findings to a specific client's unique context, rather than blindly adopting a protocol. The correct approach represents best professional practice because it prioritizes a systematic and ethical process for integrating research into practice. This involves a thorough assessment of the client's needs, a critical review of relevant literature, and a careful consideration of the feasibility and ethical implications of applying a particular intervention. The Behavior Analyst Certification Board, BAC, Professional and Ethical Compliance Code for Behavior Analysts. The code emphasizes the importance of using scientifically evaluated methods and ensuring that services are based on research and data. Code 2022, Section 101. Furthermore, it mandates that behavior analysts only practice within their defined scope of competence and that they must obtain informed consent, which includes discussing the potential risks and benefits of interventions. Code 2022, Section 1. This approach ensures that interventions are not only evidence-based, but also tailored to the individual and delivered competently and ethically. An incorrect approach that involves immediately implementing a novel intervention described in a recent study without further investigation fails to meet the ethical standards. This bypasses the crucial step of evaluating the research's generalizability, the study's methodology, and the intervention's suitability for the specific client. It could lead to ineffective or even harmful interventions, violating the duty to provide competent services and protect client welfare. Code 2022, Section 10104. Another incorrect approach, which is to dismiss the research entirely because it is not widely established, is also problematic. While caution is warranted, dismissing potentially effective interventions without a thorough review of their merits and applicability is a disservice to clients and goes against the principle of staying current with scientific advancements. Code 2022, Section 101. Finally, an approach that prioritizes convenience or familiarity over evidence-based practice, even if it appears to be working, is ethically unsound. The code mandates the use of scientifically evaluated methods, and relying on personal preference or ease of implementation over research support is a failure to adhere to this core principle. Code 2022, Section 101. The professional decision-making process for similar situations should involve a structured approach. First, identify the client's needs and goals. Second, conduct a comprehensive literature search for evidence-based practices relevant to those needs. Third, critically appraise the quality and applicability of the research findings, considering factors like study design, participant characteristics, and outcome measures. Fourth, evaluate the feasibility of implementing the intervention within the client's context, including resource availability, client and caregiver capacity, and potential ethical concerns. Fifth, discuss the findings and proposed intervention with the client or their guardian, obtaining informed consent. Finally, implement the intervention with ongoing data collection and evaluation to ensure its effectiveness and make necessary adjustments. Question 2. The analysis reveals that a board-certified behavior analyst, BCBA, is tasked with assessing a young child's challenging behavior. The BCBA has access to the child's parents and the child's preschool teacher. Which of the following approaches would best align with the ethical and professional standards for conducting an indirect assessment in this scenario? Option A. Administer a complex, adult-level questionnaire to the parents and ask them to complete it without further discussion or clarification. Option B. Rely solely on a brief, informal chat with the parents during a single visit, assuming they will volunteer all necessary information. Option C. Conduct structured interviews with both the parents and the preschool teacher, asking detailed questions about the frequency, intensity, antecedents, and consequences of the challenging behavior, as well as the child's strengths and preferences. Option D. Focus exclusively on direct observation of the child during a single, short session at the clinic, without gathering any information from caregivers or educators. Correct answer is C. Conduct structured interviews with both the parents and the preschool teacher, asking detailed questions about the frequency, intensity, antecedents, and consequences of the challenging behavior, as well as the child's strengths and preferences. Explanation. This scenario presents a common challenge in applied behavior analysis, obtaining comprehensive and accurate information from stakeholders to inform assessment and intervention planning. The professional challenge lies in balancing the efficiency of indirect methods with the potential for subjective bias, recall errors, and differing perspectives among informants. Careful judgment is required to triangulate information and identify potential discrepancies. The correct approach represents best professional practice because it prioritizes gathering information directly from individuals who interact with the client regularly and can provide detailed accounts of behavior in naturalistic settings. This aligns with ethical guidelines that mandate thorough assessment and the use of multiple sources of information when possible. Specifically, the Behavior Analyst Certification Board-backed Professional and Ethical Compliance Code for Behavior Analysts, the Code, emphasizes the importance of conducting appropriate assessments, Code 2.0.1, and obtaining information from multiple sources when relevant to the assessment, Code 2.0.2. Interviews and questionnaires, when structured and systematically administered, can elicit rich qualitative data about the target behavior, its antecedents and consequences, as well as the client's preferences and strengths. An incorrect approach that relies solely on a single, brief interview with a parent who has limited direct observation time fails to meet the ethical standard of thorough assessment. This approach risks incomplete or inaccurate data due to the informant's limited exposure to the behavior in its natural context, potentially leading to an ineffective or even harmful intervention. The code requires behavior analysts to use assessment methods that are scientifically evaluated and to ensure that assessments are not unduly influenced by subjective factors. Code 2.0.1. Relying on a single, potentially biased, or incomplete source of information violates this principle. Another incorrect approach that involves administering a standardized questionnaire without considering the client's age, cognitive abilities, or cultural background is also professionally unacceptable. The code mandates that behavior analysts use appropriate assessment tools and that these tools are valid and reliable for the population being assessed. Code 2.0.1. A questionnaire that is too complex or not culturally sensitive may yield meaningless or misleading data, hindering effective assessment. A third incorrect approach that involves only observing the client during a structured assessment session without gathering any indirect information from caregivers or educators, overlooks the critical role of context and the client's behavior in their natural environments. While direct observation is crucial, it often needs to be supplemented with indirect methods to understand the full picture of the behavior and its function. The code encourages the use of multiple sources of information to inform assessment and intervention. Code 2.0.2. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the target behavior and the assessment goals. 2. Consider the client's age, developmental level, and any communication challenges. 3. Select appropriate indirect assessment methods, e.g., interviews, checklists, rating scales, that are validated and suitable for the client and informants. 4. Prioritize gathering information from individuals who have frequent and direct contact with the client in relevant settings. 5. Systematically administer chosen methods, ensuring clarity and understanding for informants. 6. Triangulate information from multiple sources to identify consistencies and discrepancies. 7. Use the gathered information to develop hypotheses about the function of the behavior. 8. Always adhere to the back code, ensuring that assessments are comprehensive, ethical, and scientifically sound. Question 3. The efficiency study reveals that a particular intervention package for reducing self-injurious behavior is achieving a statistically significant reduction in target behavior frequency within a shorter time frame compared to previous methods. However, the study does not detail the functional assessment conducted for each participant or the individualization of the intervention components. Behavior Analyst is considering adopting this package for a new client with similar presenting behaviors. Which of the following represents the most ethically sound and professionally responsible course of action? Option A. Focus on collecting data that visually demonstrates a rapid decrease in self-injurious behavior, even if it means overlooking potential side effects or the lack of skill acquisition, to align with the efficiency study's findings. Option B. Immediately implement the intervention package as described in the efficiency study, assuming its reported effectiveness will generalize to the new client due to the similarity in presenting behaviors, thereby maximizing efficiency. Option C. Modify the intervention package to include a higher density of reinforcement for any reduction in self-injurious behavior, regardless of the behavior's function, to accelerate progress as suggested by the efficiency study. Option D. Conduct a thorough functional assessment for the new client to understand the specific maintaining variables of their self-injurious behavior, and then adapt the intervention package based on these findings, prioritizing individual needs and ethical considerations over the study's reported efficiency. The correct answer is D. Conduct a thorough functional assessment for the new client to understand the specific maintaining variables of their self-injurious behavior, and then adapt the intervention package based on these findings, prioritizing individual needs and ethical considerations over the study's reported efficiency. Explanation. This scenario presents a professional challenge because it requires a behavior analyst to balance the pursuit of efficiency with the ethical imperative to ensure the effectiveness and appropriateness of interventions for individuals with developmental disabilities. The pressure to demonstrate rapid progress, as suggested by the efficiency study, can lead to a temptation to adopt methods that may be superficially effective but lack long-term utility or respect for client dignity. Careful judgment is required to prioritize client well-being and adherence to ethical standards over mere speed of progress. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the individual's needs and the functional relationship between behavior and environment before implementing or modifying interventions. This aligns with the Behavior Analyst Certification Board's BAC, Professional and Ethical Compliance Code for Behavior Analysts, specifically the emphasis on client welfare and the use of evidence-based practices. Focusing on functional assessment and individualized treatment plans ensures that interventions are not only effective, but also tailored to the unique needs of the client, promoting generalization and maintenance of skills. This approach upholds the principle of providing services that are scientifically sound and ethically responsible. An incorrect approach that focuses solely on increasing the rate of reinforcement without considering the function of the behavior or the client's individual learning style is ethically problematic. This could lead to the reinforcement of inappropriate behaviors or the failure to address the underlying causes of the target behavior, potentially violating the principle of providing effective services. Another incorrect approach that involves implementing a standardized, high-intensity intervention without a thorough assessment of its suitability for the individual disregards the ethical obligation to conduct functional assessments and develop individualized treatment plans. This can lead to ineffective or even harmful interventions, violating the principle of client welfare. A third incorrect approach that prioritizes a visually impressive but functionally irrelevant data display over actual client progress demonstrates a lack of integrity and a failure to uphold the ethical responsibility to accurately represent services and outcomes. This misrepresents the effectiveness of the intervention and can mislead stakeholders, violating the principle of honesty and integrity. Professionals should employ a decision-making framework that begins with a thorough functional assessment to understand the antecedents and consequences maintaining the target behavior. This assessment should inform the development of an individualized treatment plan that is evidence-based and ethically sound. Regular data collection and analysis are crucial to monitor progress and make data-driven decisions about intervention adjustments. When faced with pressure for efficiency, professionals must critically evaluate whether proposed changes align with the client's best interests and ethical guidelines, rather than solely focusing on speed or superficial outcomes. Consultation with supervisors or peers can also be valuable in navigating complex ethical dilemmas. Question 4. Market research demonstrates that clients often exhibit different behaviors when they are aware of being directly observed in a specific setting. A board-certified behavior analyst, BCBA, is conducting a functional assessment for a child with autism spectrum disorder who has been exhibiting significant aggression at home during mealtimes. The child's parents have expressed concern that the child becomes highly agitated and resistant to any form of direct observation during mealtimes, making it difficult to collect accurate data in the natural environment. What is the most ethically and professionally sound approach for the BCBA to proceed with the behavioral assessment? Option A. Discuss the parents' concerns with them and explore alternative assessment methods, such as indirect assessments, e.g., interviews with parents, review of records, and potentially less intrusive direct observation techniques, e.g., brief observation periods, observation from a distance, or observation during a less sensitive activity that might precede or follow mealtimes, seeking their consent for the revised plan. Option B. Rely solely on indirect assessments such as parent interviews and questionnaires to gather information about the aggression during mealtimes, as direct observation has proven to be too challenging. Option C. Inform the parents that direct observation is the only valid method for this assessment, and suggest they try to manage the child's agitation during mealtimes so that the BCBA can conduct the observation as scheduled. Option D. Proceed with direct observation during mealtimes as originally planned, explaining to the parents that accurate data collection in the natural environment is paramount, even if it causes some temporary distress to the child. The correct answer is A. Discuss the parents' concerns with them and explore alternative assessment methods, such as indirect assessments, e.g., interviews with parents, review of records, and potentially less intrusive direct observation techniques, e.g., brief observation periods, observation from a distance, or observation during a less sensitive activity that might precede or follow mealtimes, seeking their consent for the revised plan. Explanation. This scenario presents a professional challenge because the behavior analyst must balance the need for efficient data collection with the ethical imperative to ensure the assessment accurately reflects the client's behavior in their natural environment. The client's resistance to direct observation in a specific setting necessitates a thoughtful and adaptable approach to behavioral assessment, requiring careful consideration of the Behavior Analyst Certification Board, BAC, Professional and Ethical Compliance Code for Behavior Analysts, the Code. The correct approach represents best professional practice because it prioritizes the client's well-being and the integrity of the assessment by seeking consent and employing alternative, less intrusive methods when direct observation is problematic. This aligns with Code 1.01, Beneficence and Non-Maleficence, by avoiding harm, client distress, and promoting good, accurate assessment, and Code 1.02, Informed Consent, by ensuring the client or their guardian is informed and agrees to the assessment procedures. Furthermore, Code 4.01, Behavior Analytic Assessment, mandates that assessments are conducted only after they are described to the client, and that the least restrictive procedures are used when possible. An incorrect approach that involves proceeding with direct observation without addressing the client's resistance or obtaining renewed consent would violate Code 1.02, Informed Consent, by failing to respect the client's autonomy and right to withdraw consent or refuse services. It could also be seen as a violation of Code 1.01, Beneficence and Non-Maleficence, if the observation causes significant distress. Another incorrect approach, such as relying solely on indirect assessments without attempting any form of direct observation, might not provide a comprehensive understanding of the target behavior in its natural context, potentially violating Code 4.0.1, Behavior Analytic Assessment, by not gathering sufficient information for effective intervention planning. Finally, an approach that involves fabricating or misrepresenting data to avoid the challenge of direct observation would be a severe ethical violation, contravening Code 1.0.7, Integrity, and Code 2.0, Responsibility to Clients. The professional decision-making process for similar situations should involve a systematic evaluation of the ethical principles and rules outlined in the BAC code. When faced with obstacles to standard assessment procedures, behavior analysts should first attempt to understand the source of the obstacle, e.g., client discomfort, environmental barriers. They should then explore alternative assessment methods that are still scientifically sound and ethically permissible, always prioritizing client assent and consent. Open communication with the client and relevant stakeholders is crucial throughout this process. If direct observation in the natural environment remains impossible or highly problematic, the analyst must document these challenges and justify the chosen assessment methods, ensuring they still meet the requirements for a functional assessment to the best of their ability. Question 5. During the evaluation of a child exhibiting frequent tantrums, a behavior analyst collects data through direct observation, interviews with parents, and a functional assessment interview. The observational data indicates that tantrums often occur when the child is asked to transition from a preferred activity to a less preferred one, and that the tantrums typically cease when the child is allowed to continue the preferred activity or is given a highly preferred item. Based on this data, what is the most appropriate initial hypothesis regarding the function of the tantrums? Option A. The tantrums are a learned behavior with no clear environmental triggers. Option B. The tantrums are maintained by escape from demands or aversive tasks. Option C. The tantrums are primarily a result of internal biological factors. Option D. The tantrums are maintained by access to tangible items or activities. The correct answer is B. The tantrums are maintained by escape from demands or aversive tasks. Explanation. This scenario presents a common challenge in applied behavior analysis, interpreting complex assessment data to form a testable hypothesis about the function of a behavior. The challenge lies in moving beyond surface-level observations to identify underlying environmental variables that maintain the behavior. Professionals must exercise careful judgment to ensure their hypotheses are directly supported by the data, are specific enough to guide intervention, and are ethically sound. The correct approach represents best professional practice because it directly aligns with the ethical principles and professional standards outlined by the Behavior Analyst Certification Board, BAC. Specifically, it adheres to the requirement to base professional decisions on data and to develop hypotheses that are directly derived from assessment findings. This ensures interventions are evidence-based and tailored to the individual's needs, as mandated by ethical codes that emphasize client welfare and competence. An incorrect approach that focuses solely on the topography of the behavior without considering the antecedent and consequence conditions fails to meet the standards of a functional assessment. This is a regulatory and ethical failure because it neglects the core principle of behavior analysis, understanding behavior in its environmental context. Such an approach is likely to lead to ineffective or even harmful interventions, violating the ethical obligation to provide competent services. Another incorrect approach that jumps to a conclusion about the function without sufficient supporting data is also a significant ethical and regulatory failure. BAC mandates that behavior analysts conduct thorough assessments and base their hypotheses and interventions on empirical evidence. Making assumptions or relying on anecdotal information rather than systematically collected data is a breach of professional responsibility and can compromise client outcomes. The professional decision-making process for similar situations should involve a systematic review of all collected assessment data, including direct observation records, interviews, and any other relevant information. The behavior analyst must then analyze the relationships between antecedents, the target behavior, and consequences to identify patterns. Hypotheses should be formulated as clear, testable statements that explain the presumed function of the behavior. If the data are insufficient to form a clear hypothesis, further assessment is warranted before proceeding with intervention planning. This iterative process of data collection, analysis, hypothesis generation, and intervention testing is fundamental to ethical and effective practice. Question 6. The monitoring system demonstrates that an unauthorized individual access client session note stored on the agency's shared drive without proper authorization. The behavior analyst is aware of this access. What is the most ethically and legally sound course of action? Option A. Report the incident to the agency's IT department and await their guidance on whether and how to inform the client. Option B. Only document the incident in internal records and take steps to improve system security without informing the client. Option C. Immediately inform the client about the unauthorized access, explain the nature of the breach, and outline the steps being taken to address it. Option D. Conduct a thorough internal investigation to determine the extent of the breach before notifying the client. The correct answer is C. Immediately inform the client about the unauthorized access, explain the nature of the breach, and outline the steps being taken to address it. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves a potential breach of confidentiality due to the unauthorized access of client information. The behavior analyst must navigate the ethical obligation to protect client privacy, while also addressing the security lapse and ensuring appropriate corrective action. The challenge lies in balancing the need for transparency with the client's right to confidentiality and the organization's responsibility for data security. Correct approach analysis. The correct approach prioritizes immediate notification to the client about the breach, as mandated by ethical codes and regulations concerning data privacy. This demonstrates transparency, respects the client's autonomy, and allows them to take necessary precautions. It aligns with the principle of informed consent, as the client must be aware of potential risks to their information. Furthermore, it initiates the process of addressing the breach responsibly and ethically. Incorrect approaches analysis. One incorrect approach involves delaying notification to the client until a full investigation is complete. This violates the ethical obligation to inform clients promptly of any breaches that may affect their personal information. Such a delay can erode trust and prevent the client from taking timely protective measures, potentially leading to further harm. It also fails to uphold the spirit of informed consent, which requires timely and relevant information. Another incorrect approach is to only report the incident internally without informing the client. This is a significant ethical and regulatory failure. Confidentiality extends to protecting client information from unauthorized access and disclosure, and failing to inform the client of a breach directly contravenes this principle. It also bypasses the client's right to know about potential risks to their sensitive data. A third incorrect approach is to dismiss the incident as a minor technical glitch without investigating or informing the client. This demonstrates a lack of diligence and a disregard for the potential impact on client privacy. Even a seemingly minor breach can have significant consequences, and ethical practice demands a thorough investigation and appropriate communication with the affected party. This approach fails to uphold professional responsibility and could lead to further security vulnerabilities. Professional reasoning. Professionals should utilize a decision-making framework that prioritizes client welfare and ethical obligations. This involves 1. Identifying the ethical and legal obligations related to confidentiality and data security. 2. Assessing the nature and potential impact of the breach. 3. Consulting relevant ethical codes and organizational policies. 4. Promptly communicating with the client in a clear and transparent manner, explaining the situation and the steps being taken. 5. Implementing corrective actions to prevent future breaches. 6. Documenting all actions taken. Question 7. Risk assessment procedures indicate that a new, commercially available mobile application has been developed that claims to deliver discrete trial training, DTT, components and collect session data for children with autism. The app has not been widely reviewed in peer-reviewed literature, and its data security protocols are not immediately transparent. As a BCBA, what is the most appropriate initial step to take regarding the potential use of this application in client interventions? Option A. Prioritize the cost-effectiveness and perceived convenience of the application, proceeding with its use if it appears to offer a financial advantage and is easy to implement. Option B. Decline to use the application due to its lack of widespread peer-reviewed validation and potential data security concerns, opting for traditional methods. Option C. Conduct a thorough review of the app's features, empirical support for its intervention components, data security measures and privacy policies, and consult relevant ethical guidelines and professional literature before considering its implementation. Option D. Immediately integrate the application into client sessions to leverage its potential for efficient data collection and intervention delivery, assuming it is a legitimate commercial product. The correct answer is C. Conduct a thorough review of the app's features, empirical support for its intervention components, data security measures, and privacy policies, and consult relevant ethical guidelines and professional literature before considering its implementation. Explanation. This scenario presents a professional challenge due to the rapid integration of technology in behavior analytic services, specifically the use of a novel app for data collection and intervention delivery. The challenge lies in balancing the potential benefits of technological efficiency and accessibility with the ethical and regulatory obligations to ensure client safety, data privacy, and the efficacy of interventions. The BCBA must carefully assess the risks and benefits of using a new, unvetted technology within the strict confines of the Behavior Analyst Certification Board, BAC, Professional and Ethical Compliance Code for Behavior Analysts. The code. The correct approach represents best professional practice because it prioritizes client welfare and adherence to the code. Specifically, it aligns with the code's emphasis on using scientifically evaluated methods and ensuring that technology used in service delivery is appropriate, effective, and secure. The code mandates that behavior analysts only implement interventions that are supported by research, and that they take reasonable steps to ensure the technology used does not compromise client rights or confidentiality. A thorough risk assessment, including evaluating the app's security features, data handling policies, and empirical support for its intervention components, is crucial before implementation. This proactive approach minimizes potential harm and upholds the integrity of the profession. An incorrect approach that involves immediately implementing the app without a thorough risk assessment fails to meet the ethical standard of competence and due diligence. This could violate the code's requirements regarding the use of technology, potentially leading to breaches of confidentiality, ineffective interventions, or even harm to the client if the app malfunctions or collects data inappropriately. Another incorrect approach, which is to dismiss the technology solely due to its novelty without objective evaluation, might overlook a potentially beneficial tool that could enhance service delivery. This could be seen as a failure to stay abreast of advancements in the field and could limit access to effective services for clients. A third incorrect approach, focusing only on the cost-effectiveness of the app without considering its efficacy or ethical implications, directly contravenes the code's mandate that financial considerations do not override the primary obligation to client welfare and the use of evidence-based practices. The professional decision-making process for similar situations should involve a systematic evaluation of any new technology. This includes 1. Identifying the potential benefits and risks to the client, 2. Researching the empirical support for the technology's effectiveness and its underlying principles, 3. Assessing the technology's security and data privacy features in accordance with relevant regulations, e.g., HIPAA in the U.S., if applicable. 4. Considering the client's capacity to engage with the technology and obtaining informed consent. And 5. Consulting with supervisors or peers if uncertainty exists. This structured approach ensures that decisions are client-centered, evidence-based, and ethically sound. Question 8. Regulatory review indicates that a behavior analyst is observing a significant reduction in a target behavior following the implementation of a new intervention. The analyst has collected data for 2 weeks post-intervention, showing a consistent downward trend. However, the analyst has not yet conducted a functional analysis or implemented any experimental design to isolate the intervention's effect from other potential influences. Which of the following represents the most appropriate next step for the behavior analyst to take in assessing the impact of the intervention? Option A. Recommend the immediate discontinuation of the intervention, as the observed reduction suggests it is no longer necessary. Option B. Conclude that the intervention is highly effective and document this success in the client's record, proceeding with maintenance strategies. Option C. Attribute the behavior change to maturational factors or other unmeasured environmental variables and suggest focusing on those instead. Option D. Propose a reversal design or a multiple baseline design to systematically evaluate the functional relationship between the intervention and the reduction in the target behavior. The correct answer is A. Recommend the immediate discontinuation of the intervention, as the observed reduction suggests it is no longer necessary. Explanation. This scenario presents a professional challenge because it requires the behavior analyst to differentiate between a naturally occurring behavior change and one that is a direct result of an intervention, while also considering the ethical implications of attributing causality without sufficient evidence. The behavior analyst must apply principles of behaviorism to interpret the observed data and make informed recommendations, adhering to professional standards and ethical guidelines. The correct approach represents best professional practice because it aligns with the fundamental principles of behaviorism, specifically the emphasis on observable and measurable behavior, and the need for experimental control to establish functional relationships. By proposing a functional analysis and systematic manipulation of variables, the behavior analyst is seeking to isolate the impact of the intervention. This methodical approach is crucial for ensuring that interventions are evidence-based and effective, thereby protecting client welfare and upholding the integrity of the profession. This aligns with the ethical obligation to provide competent services and to base practice on scientific principles. An incorrect approach that involves immediately concluding the intervention is effective without further investigation fails to establish a functional relationship. This is a regulatory and ethical failure because it leads to unsubstantiated claims about intervention efficacy, potentially resulting in the continuation of ineffective or even harmful practices. It violates the principle of data-based decision-making and the ethical requirement to only claim credit for work actually performed and supported by data. Another incorrect approach, which involves attributing the behavior change to external, unmeasured factors without systematic evaluation, is also a regulatory and ethical failure. This demonstrates a lack of understanding of basic behaviorism principles, particularly the focus on environmental variables as the primary drivers of behavior. It can lead to misinterpretations of data and inappropriate treatment planning, potentially harming the client by overlooking the true function of the behavior or the effectiveness of the intervention. A further incorrect approach, such as discontinuing the intervention based on a single observation of improvement without considering the possibility of spontaneous remission or other confounding variables, is an ethical failure. It demonstrates a lack of rigorous data analysis and a failure to establish a clear functional relationship. This can lead to premature termination of potentially beneficial interventions and a disservice to the client. Professionals should approach such situations by first collecting baseline data, implementing the intervention, and then systematically collecting data during the intervention phase. If behavior change is observed, the next step is to consider experimental designs, e.g., reversal, multiple baseline, to demonstrate a functional relationship between the intervention and the behavior change. This data-driven, experimental approach ensures that conclusions are scientifically sound and ethically defensible, prioritizing client outcomes and professional integrity. Question 9. Process analysis reveals that a board-certified behavior analyst is tasked with assessing a young child's communication deficits. The practitioner has developed a comprehensive informal observation checklist based on common communication milestones. Which of the following approaches best aligns with the ethical and regulatory requirements for using standardized assessment tools in this scenario? Option A. Employing a standardized assessment tool that measures general cognitive abilities, assuming this will indirectly capture communication deficits. Option B. Administering a validated, norm-referenced assessment tool specifically designed to measure early communication skills in children of similar age and developmental profiles. Option C. Utilizing the practitioner's self-developed informal observation checklist, as it is tailored to the specific behaviors observed in the child. Option D. Relying primarily on detailed interviews with the child's parents to gather information about communication abilities, without formal assessment. The correct answer is B. Administering a validated, norm-referenced assessment tool specifically designed to measure early communication skills in children of similar age and developmental profiles. Explanation. Scenario analysis. This scenario presents a common challenge where a practitioner must balance the need for efficient service delivery with the ethical and regulatory imperative to use appropriate, validated assessment tools. The pressure to demonstrate progress quickly can lead to the temptation to use less rigorous methods, potentially compromising the integrity of the assessment and the effectiveness of the intervention. Careful judgment is required to ensure that assessment practices align with professional standards and client best interests. Correct approach analysis. The correct approach involves selecting and administering a standardized assessment tool that is evidence-based and appropriate for the client's age, developmental level, and presenting concerns. This aligns with the BACP emphasis on using scientifically validated procedures and ethical guidelines that mandate competent practice, which includes accurate and reliable assessment. Standardized tools provide normative data and psychometric properties that allow for objective measurement of behavior, comparison to peers, and tracking of progress over time, thereby ensuring that interventions are data-driven and effective. Incorrect approach is analysis. Using a non-standardized, informal observation checklist without psychometric validation for the specific target behavior and population is a failure to adhere to the principle of using scientifically validated procedures. While informal observation is a component of assessment, relying solely on it without a standardized tool can lead to subjective interpretations and unreliable data, potentially violating the ethical requirement for competent practice. Administering a standardized assessment tool that has not been validated for the client's specific cultural background or language can lead to inaccurate results. This is a failure of competence and can result in misdiagnosis or inappropriate intervention planning, violating ethical principles related to cultural responsiveness and client welfare. Relying solely on subjective reports from caregivers without corroborating objective assessment data, even if using a structured interview format, can be problematic. While caregiver reports are valuable, they are not a substitute for direct, objective measurement of behavior using validated tools, which is essential for establishing baselines and measuring treatment effects accurately according to professional standards. Professional reasoning. Professionals should approach assessment by first identifying the target behavior and the client's needs. They should then research and select assessment tools that are evidence-based, psychometrically sound, and appropriate for the client's characteristics. This involves considering the tool's reliability, validity, and norms. The assessment should be administered according to the standardized protocol, and the results should be interpreted in the context of the client's overall presentation. If no suitable standardized tool exists, the practitioner must consider developing or adapting one, ensuring it undergoes rigorous validation before use, or clearly documenting the limitations of using non-standardized methods. This systematic approach ensures ethical and effective practice. Question 10. The assessment process reveals that a client who has been receiving services for significant communication deficits expresses a strong preference for a particular communication strategy that is not supported by current evidence-based research for their specific needs, despite the behavior analyst's recommendation of a different evidence-based approach. Option A. Discontinue services due to the disagreement, as it indicates a lack of client buy-in for effective treatment. Option B. Discuss the evidence supporting the recommended approach, explore the client's reasons for preferring the alternative strategy, and collaboratively develop a plan that addresses the client's concerns while prioritizing effective, evidence-based interventions. Option C. Immediately implement the client's preferred communication strategy to honor their autonomy, even if it is not the most effective evidence-based option. Option D. Insist on implementing the evidence-based strategy without further discussion, dismissing the client's preference as uninformed. The correct answer is B. Discuss the evidence supporting the recommended approach, explore the client's reasons for preferring the alternative strategy, and collaboratively develop a plan that addresses the client's concerns while prioritizing effective, evidence-based interventions. Explanation. This scenario presents a professional challenge due to the potential conflict between a client's stated preference and the behavior analyst's ethical obligation to ensure services are based on scientific principles and are effective. The behavior analyst must navigate this by prioritizing client well-being and the integrity of the intervention, while also respecting client autonomy. The correct approach represents best professional practice because it upholds the core ethical principles of beneficence and non-maleficence by ensuring the intervention is evidence-based and likely to produce meaningful outcomes. It also adheres to the principle of integrity by maintaining professional competence and objectivity. Specifically, the Behavior Analyst Certification Board, BACP, Ethics Code for Behavior Analysts, effective January 1, 2024, mandates that behavior analysts only conduct research or provide services within their scope of competence, and that services are based on scientific and professional knowledge. When a client expresses a preference that conflicts with evidence-based practice, The behavior analyst has a responsibility to educate the client about the rationale behind the recommended intervention, discuss alternative evidence-based approaches, and collaboratively develop a plan that balances effectiveness with client values. This involves a thorough discussion of potential risks and benefits of different options. An incorrect approach that involves immediately implementing the client's preferred, but potentially less effective, intervention without further investigation or discussion fails to uphold the principle of beneficence. It risks providing a service that is not in the client's best interest and may not lead to the desired behavioral change, potentially wasting client resources and time. This also violates the ethical requirement to base services on scientific and professional knowledge. Another incorrect approach, which involves dismissing the client's preference outright and insisting on the initially proposed intervention, without exploring the client's reasoning or potential barriers to acceptance, demonstrates a lack of respect for client autonomy and can damage the therapeutic alliance. While the behavior analyst must ensure effectiveness, the process of achieving that effectiveness should be collaborative. This approach could be seen as a failure to engage in effective communication and a disregard for the client's perspective, potentially leading to non-adherence and reduced treatment efficacy. A third incorrect approach, which involves discontinuing services due to the disagreement without attempting to resolve the conflict or refer the client to another qualified professional, could be considered abandonment if the client is still in need of services and the behavior analyst has not taken appropriate steps to ensure continuity of care. The BCBA Ethics Code emphasizes the importance of maintaining professional relationships and ensuring appropriate referrals when necessary. The professional decision-making process for similar situations should involve 1. Actively listening to and understanding the client's stated preference and the underlying reasons for it. 2. Reviewing the evidence base for the proposed intervention and the client's preferred alternative. 3. Educating the client about the scientific rationale, potential benefits, and risks of all viable options. 4. Collaboratively problem-solving to find a mutually agreeable plan that prioritizes effective and ethical service delivery. 5. Documenting all discussions, decisions, and rationale. 6. Seeking supervision or consultation if the situation is complex or presents ethical dilemmas. Question 11. Implementation of a constant, high level of physical prompting to teach a client to independently request a preferred item has resulted in the client consistently requesting the item only when prompted. The behavior technician reports that the client appears to understand the request but does not initiate it without the prompt. What is the most appropriate next step for the BCBA to guide the technician? Option A. Advise the technician to continue using the high level of physical prompting until the client is observed to initiate the request spontaneously, as this indicates mastery. Option B. Recommend that the technician immediately cease all physical prompting and observe if the client attempts to request the item independently. Option C. Suggest the technician ask the client if they want the item, as verbal questioning is a less intrusive antecedent intervention. Option D. Instruct the technician to systematically fade the physical prompts based on the client's demonstrated ability to respond to less intrusive prompts, while continuing to collect data on independent requests. The correct answer is D. Instruct the technician to systematically fade the physical prompts based on the client's demonstrated ability to respond to less intrusive prompts, while continuing to collect data on independent requests. Explanation. This scenario presents a common implementation challenge where a behavior technician is struggling to fade prompts effectively, leading to continued reliance on a high level of support. The professional challenge lies in balancing the need for immediate skill acquisition and independence with the ethical obligation to use the least intrusive intervention necessary, and to ensure the client's progress is not hindered by an overly supportive prompting strategy. The BCBA must guide the technician to adjust the intervention based on the client's response, adhering to ethical principles and best practices in behavior analysis. The correct approach represents best professional practice because it involves a systematic and data-driven process of fading prompts. This aligns with the ethical requirement to use the least restrictive procedures and to ensure interventions are effective and individualized. By observing the client's performance and systematically reducing the level of prompting based on their ability to respond independently, the BCBA ensures that the intervention is gradually moving towards independence, which is a core goal of behavior analytic services. This process is also consistent with the BCBA Ethical Code, which emphasizes the importance of data-based decision-making and client progress. An incorrect approach of continuing with the same high level of prompting indefinitely would be ethically problematic. This fails to progress the client towards independence and may violate the principle of using the least restrictive intervention. It also suggests a lack of systematic data analysis and intervention adjustment, which is a core ethical responsibility. Another incorrect approach of immediately removing all prompts without regard for the client's current performance would likely lead to failure and frustration, potentially violating the ethical principle of ensuring client dignity and well-being. It also fails to acknowledge the importance of systematic fading. A third incorrect approach of solely relying on the technician's subjective opinion without objective data collection and analysis would be a failure to adhere to evidence-based practice and ethical standards that mandate data-driven decision-making. Professionals should use a decision-making framework that prioritizes ongoing data collection and analysis. When an intervention is not yielding the desired progress towards independence, the professional must systematically evaluate the current procedures. This involves analyzing the data to determine the client's response to the current level of prompting. Based on this analysis, the professional should then adjust the prompting strategy, typically by systematically fading the prompts in a manner that is responsive to the client's performance. This iterative process of assessment, intervention, and reassessment is fundamental to ethical and effective behavior analytic practice. Question 12. Governance review demonstrates that a behavior analyst has been asked by a client's family to implement a specific intervention for a child's challenging behavior. The family has observed this intervention being used successfully in a different context and is insistent on its application. However, the behavior analyst's initial assessment suggests that this intervention may not be the most effective or appropriate given the child's specific behavioral function and environmental variables. The behavior analyst must decide how to proceed while upholding their ethical obligations. Which of the following approaches best aligns with the responsibilities to clients and stakeholders as outlined by the BCBA Ethical Code for Behavior Analysts? Option A. Immediately implement the intervention requested by the family, as their satisfaction is paramount to maintaining a positive working relationship and ensuring client engagement. Option B. Conduct a comprehensive functional assessment to determine the function of the behavior, and then propose evidence-based interventions that are most likely to be effective and least likely to cause harm, while openly discussing the assessment findings and rationale with the family. Option C. Decline to provide services altogether, as the family's insistence on a potentially inappropriate intervention indicates a fundamental disagreement that cannot be ethically resolved. Option D. Implement the intervention requested by the family, but refrain from discussing the assessment findings or the potential limitations of the intervention to avoid causing unnecessary distress or conflict. The correct answer is B. Conduct a comprehensive functional assessment to determine the function of the behavior, and then propose evidence-based interventions that are most likely to be effective and least likely to cause harm, while openly discussing the assessment findings and rationale with the family. Explanation. Scenario analysis. This scenario presents a common professional challenge where a behavior analyst must navigate competing interests and potential conflicts of commitment. The client's family is requesting a service that may not be the most effective or ethical intervention based on the behavior analyst's professional judgment and the principles of applied behavior analysis. The behavior analyst must balance the family's desires with their ethical obligation to provide effective services and protect the client's well-being, all while adhering to the BCBA Ethical Code. This requires careful consideration of the client's best interests, the scientific validity of proposed interventions, and the professional relationship with the stakeholders. Correct approach analysis. The correct approach prioritizes the client's well-being and the integrity of behavior analytic services. It involves a thorough assessment to determine the function of the behavior and to identify evidence-based interventions that are most likely to be effective and least likely to cause harm. This aligns directly with the BCBA Ethical Code for Behavior Analysts, specifically the principle of beneficence and non-maleficence, Principle I, which mandates that behavior analysts act in the best interests of their clients and avoid causing harm. It also aligns with the responsibility to provide effective services, Standard 1.01, and to conduct assessments and interventions that are based on research and best practice, Standard 1.02. 02. Open and honest communication with the family about the assessment findings and the rationale for recommended interventions is crucial for maintaining a collaborative and ethical relationship. Incorrect approaches analysis. One incorrect approach involves immediately agreeing to the family's request without further assessment. This violates the ethical obligation to provide effective services, Standard 101, and to base interventions on scientific principles and research, Standard 102. It also risks causing harm to the client by implementing an ineffective or potentially detrimental intervention, thus failing the principle of beneficence and non-maleficence, Principle I. This approach prioritizes stakeholder satisfaction over client welfare and professional integrity. Another incorrect approach is to refuse to provide any services because the family's initial request is not aligned with best practice. This fails to uphold the responsibility to serve clients, Standard 101, and to seek to resolve conflicts in a way that prioritizes the client's welfare. While the initial request may be problematic, a behavior analyst has an ethical duty to explore alternative, evidence-based solutions and to educate stakeholders. This approach could be seen as abandoning the client or failing to engage in problem-solving, which is contrary to the spirit of ethical practice. A third incorrect approach is to implement the requested intervention without clearly explaining the rationale or potential limitations to the family. This undermines informed consent and the collaborative nature of service delivery. While the intervention might be superficially aligned with the family's request, the lack of transparency and education about its efficacy and potential risks is an ethical failure. It does not uphold the principle of integrity, Principle Roman 4, which emphasizes honesty and accuracy, nor does it fully adhere to the responsibilities to clients and supervisors, Standard 103, which includes ensuring that stakeholders understand the services being provided. Professional reasoning. When faced with a discrepancy between stakeholder requests and evidence-based practice, behavior analysts should employ a systematic decision-making process. This involves 1. Actively listening to and understanding the stakeholders' concerns and requests. 2. Conducting a thorough functional assessment to understand the behavior in question. 3. Consulting relevant research and best practices to identify effective and ethical interventions. 4. Clearly communicating assessment findings and evidence-based recommendations to stakeholders, explaining the rationale and potential benefits and risks of different approaches. 5. Collaborating with stakeholders to develop a treatment plan that is in the client's best interest and aligns with ethical guidelines. 6. Documenting all assessments, communications, and decisions. If a significant ethical conflict arises that cannot be resolved through communication and collaboration, seeking supervision or consultation is essential. Question 13. Risk assessment procedures indicate that a client's engagement with educational tasks is a primary target for intervention, with the goal of increasing the amount of time the client spends actively participating in these tasks. Which data collection technique will most accurately and ethically capture the progress towards this specific goal? Option A. Recording the time elapsed between the instruction to begin the task and the client's first action. Option B. Writing narrative descriptions of the client's engagement throughout the session. Option C. Measuring the duration of time the client spends actively engaged in the educational task. Option D. Counting the number of times the client initiates engagement with the educational task. Correct answer is C. Measuring the duration of time the client spends actively engaged in the educational task. Explanation. Scenario analysis. This scenario presents a common challenge in behavior analysis where multiple data collection methods are potentially applicable, but the choice significantly impacts the fidelity and utility of the intervention. The professional must discern which method best captures the target behavior's essence and is most appropriate for the specific intervention goals and the client's context, while adhering to ethical and regulatory standards. The challenge lies in moving beyond simply recording data to strategically selecting the most informative and defensible method. Correct approach analysis. Selecting duration as the primary data collection method is the best professional practice in this instance. The BACP ethical code, e.g., Section 1.01 Reliance on scientific knowledge 1.02 Integrity 4.01 Maintaining competence 4.02 Integrity of assessment 4.04 Accuracy and use of assessment data 4.05 Obtaining consent for assessment emphasizes the importance of using scientifically validated methods and ensuring data accurately reflects behavior for effective intervention. Duration directly measures the amount of time a behavior occurs, which is crucial when the goal is to increase or decrease the length of engagement in a specific activity, as implied by the focus on time spent engaging. This method provides a clear, quantifiable measure directly aligned with the intervention's objective. Incorrect approach is analysis. Choosing frequency alone would be an ethical and regulatory failure because it only counts occurrences, not how long each occurrence lasts. If the goal is to increase the time spent on a task, simply counting how many times a child picks up a toy is insufficient if each instance is fleeting. This misrepresents the actual engagement and could lead to an inaccurate assessment of progress, violating the principle of accurate data use. 4.04. Selecting latency alone would also be an ethical and regulatory failure. Latency measures the time between a stimulus and the response which is relevant for tasks requiring promptness, but not for measuring the overall engagement with an activity. Applying latency here would not capture the duration of the behavior itself, failing to address the core objective of increasing time spent engaging, thus compromising data integrity. 4.02. Using anecdotal records without a defined measurement system would be a significant ethical and regulatory failure. While anecdotal records can provide context, they lack the objectivity and quantification required for scientific behavior analysis. They are not a standardized data collection technique and do not meet the standards for reliable and valid measurement, potentially violating the reliance on scientific knowledge. 1.01 and integrity of assessment. 4.02. Professional reasoning. Professionals should first clearly define the target behavior and the specific intervention goals. Then they should consider which measurement dimension, frequency, duration, latency, intensity, etc. most accurately and meaningfully reflects the behavior in relation to those goals. The chosen method must be objective, quantifiable, and reliable. Finally, the professional must ensure the chosen method aligns with the BCBA ethical code and any relevant legal or regulatory requirements for data collection and reporting. Question 14. The evaluation methodology shows that a client has successfully acquired a new skill during direct therapy sessions, but exhibits significant difficulty applying this skill in their home environment and maintaining it when therapy sessions are reduced. Which of the following approaches best reflects the professional and ethical responsibility to ensure meaningful and lasting behavior change? Option A. Recommend that the client's caregivers implement the exact same intervention procedures used in therapy sessions without further training or adaptation. Option B. Implement a plan to systematically introduce the skill in various naturalistic settings, involve caregivers in training, and fade prompts and reinforcement schedules to mimic natural contingencies. Option C. Increase the frequency of therapy sessions in the controlled setting to reinforce the skill and ensure it is performed correctly during sessions. Option D. Conclude that the intervention was successful, as the skill was acquired in the controlled therapy setting, and focus on identifying a new skill to target. The correct answer is B. Implement a plan to systematically introduce the skill in various naturalistic settings, involve caregivers in training, and fade prompts and reinforcement schedules to mimic natural contingencies. Explanation. The evaluation methodology shows a client has achieved a target behavior in a controlled setting, but struggles to perform it in new environments or after the intervention is withdrawn. This scenario is professionally challenging because it highlights the critical, yet often overlooked, aspects of generalization and maintenance, which are fundamental to achieving lasting behavior change and ensuring the client's long-term benefit. The BCBA must assess whether the intervention has truly been effective in the broader sense, not just in the immediate, artificial context. The correct approach represents best professional practice because it directly addresses the client's functional needs in their natural environment and over time, focusing on strategies that promote generalization and maintenance, such as training in multiple settings, using naturally reinforcing consequences, and fading prompts systematically, aligns with the ethical obligation to provide effective services that lead to meaningful and durable behavior change. This approach prioritizes the client's autonomy and independence beyond the direct supervision of the behavior analyst, which is a core principle of ethical practice. An incorrect approach that focuses solely on the acquisition of the behavior in the clinic setting fails to meet the ethical standard of ensuring that services are effective and lead to generalized outcomes. This neglects the responsibility to prepare the client for real-world application, potentially leading to wasted resources and a lack of sustained progress. Another incorrect approach that involves abruptly terminating services once the behavior is observed in the clinic setting is ethically problematic, as it abandons the client before ensuring the behavior is maintained and generalized, thereby failing to uphold the duty of care and potentially causing harm through lack of continued support. A third incorrect approach that relies on continued intensive intervention in the clinic to maintain the behavior is also flawed, as it does not promote independence and generalization, and is not a sustainable or cost-effective long-term solution, failing to meet the client's needs for independent functioning. Professionals should use a decision-making framework that begins with defining clear, functional goals that include generalization and maintenance from the outset of intervention planning. This involves proactively designing interventions that incorporate strategies for these critical components. When evaluating progress, the focus should be on performance across various settings and over time, not just in controlled environments. If generalization and maintenance are not occurring, the professional must systematically analyze the variables contributing to this deficit and adjust the intervention plan accordingly, always prioritizing the client's ultimate benefit and independence. Question 15. Investigation of a client's limited verbal repertoire and difficulty with independent task completion, who has a documented history of aggression when presented with structured learning activities, requires a behavior analyst to select the most appropriate initial assessment strategy. Which of the following strategies best aligns with ethical and effective practice for assessing skill deficits in this context? Option A. Conduct a comprehensive functional assessment, beginning with indirect assessments, e.g., interviews with caregivers, review of records, and environmental observations, to inform the selection of appropriate and least intrusive direct assessment methods. Option B. Immediately implement a standardized, direct assessment protocol for the target skills in a controlled setting to obtain objective data on performance. Option C. Postpone any direct assessment of skill deficits until the client's aggression can be fully managed through separate behavioral interventions. Option D. Rely exclusively on caregiver reports and anecdotal observations to determine the extent of the skill deficit, as direct assessment may be too disruptive. The correct answer is A. Conduct a comprehensive functional assessment, beginning with indirect assessments, e.g., interviews with caregivers, review of records, and environmental observations, to inform the selection of appropriate and least intrusive direct assessment methods. Explanation. Scenario analysis. This scenario presents a common challenge in behavior analysis, identifying the most effective and ethical method for assessing skill deficits in a client with limited communication. The professional must balance the need for accurate data collection with the client's comfort, dignity, and the potential for the assessment process itself to be aversive or to inadvertently reinforce maladaptive behaviors. The client's history of aggression during structured tasks adds a layer of complexity, requiring a proactive approach to safety and ethical considerations. Correct approach analysis. The correct approach prioritizes a functional assessment that considers the client's environment and the function of their behavior. By observing the client in their natural environment and conducting indirect assessments, interviews, record reviews, the behavior analyst can gather rich contextual information. This information informs the selection of direct assessment methods that are least intrusive and most likely to yield valid data without escalating challenging behavior. This aligns with ethical standards that emphasize client welfare, informed consent, or assent where applicable, and the use of the least restrictive procedures. Specifically, the Behavior Analyst Certification Board, BAC, Professional and Ethical Compliance Code for Behavior Analysts, the Code, mandates that behavior analysts conduct assessments that are based on scientific principles and are appropriate for the client's needs and circumstances. The Code also emphasizes the importance of considering the client's environment and history when designing assessments. Incorrect approaches analysis. One incorrect approach involves immediately implementing a highly structured, direct assessment without first gathering environmental or indirect data. This fails to account for the client's history of aggression during similar tasks and could lead to an escalation of challenging behavior, violating the code's emphasis on avoiding harm and using least restrictive procedures. It also bypasses a crucial step in functional assessment, potentially leading to inaccurate conclusions about the skill deficit. Another incorrect approach might be to rely solely on indirect assessments without any direct observation or measurement. While indirect assessments are valuable, they are prone to subjective bias and may not accurately reflect the client's actual skill level or the environmental variables influencing their behavior. The code requires behavior analysts to use multiple sources of information and to collect data that is objective and verifiable. A third incorrect approach could be to postpone assessment indefinitely due to the client's history of aggression. This would be a failure to provide services and would not be in the client's best interest, as it prevents the identification and remediation of skill deficits. The code mandates that behavior analysts provide services that are needed and that they conduct assessments in a timely manner. Professional reasoning. Professionals should approach assessment by first gathering all available information, including indirect data and environmental observations, to understand the context of the skill deficit. This informs the selection of direct assessment methods that are appropriate, ethical, and least likely to cause distress or escalate challenging behavior. The process should be iterative, with ongoing data collection and analysis to ensure the assessment remains effective and aligned with the client's needs and well-being. The back code serves as the primary guide for ethical decision-making, emphasizing client welfare, competence, and integrity. Question 16. What factors determine the most effective method for developing a task analysis and implementing a chaining procedure for teaching a new functional life skill to a client with autism spectrum disorder? Option A. The client's preference for the order of learning steps and the instructor's available time for training. Option B. The learner's current skill repertoire, the complexity of the target skill, and the availability of naturalistic reinforcers. Option C. The instructor's personal experience with similar skills and the perceived ease of teaching the skill. Option D. The number of steps in a standardized task analysis found in a general textbook and the client's age. The correct answer is B. The learner's current skill repertoire, the complexity of the target skill, and the availability of naturalistic reinforcers. Explanation. This scenario presents a professional challenge because the effectiveness of a task analysis and chaining procedure is directly tied to the individual's unique learning characteristics and the complexity of the skill being taught. A one-size-fits-all approach is not only ineffective, but also ethically problematic, as it fails to uphold the principle of providing individualized services. Careful judgment is required to select and adapt procedures that maximize the client's progress and independence. The correct approach represents best professional practice because it prioritizes a data-driven and individualized assessment of the learner's current abilities and the skills components. This aligns with the BAC ethical code, specifically Standard 101, which mandates that behavior analysts practice only within their areas of competence and in accordance with the scientific and professional standards of behavior analysis. Furthermore, Standard 401 requires behavior analysts to conduct assessments that are appropriate for the client's needs and to use the least restrictive procedures that are effective. Developing a task analysis and chaining procedure based on a thorough assessment ensures that the steps are logical, the prompts are appropriate, and the reinforcement schedule is effective for the specific learner, thereby maximizing the likelihood of skill acquisition and generalization. An incorrect approach that relies solely on a pre-existing, generic task analysis without considering the individual learner's strengths, weaknesses, or prior experiences fails to meet the ethical requirement of providing individualized services, Standard 101-401. This can lead to frustration for the learner and inefficient use of resources. Another incorrect approach that focuses only on the instructor's preferred method of teaching, without empirical validation or consideration of the learner's responsiveness, violates the principle of data-based decision-making and can lead to ineffective interventions. This also disregards the ethical obligation to use effective procedures, Standard 401. A third incorrect approach that neglects to plan for generalization and maintenance of the skill after acquisition overlooks a critical component of effective behavior change, potentially leading to the skill being lost once the intensive intervention is withdrawn. This is contrary to the goal of promoting lasting behavioral change and independence. Professionals should employ a decision-making framework that begins with a comprehensive functional assessment and skills assessment to understand the learner's current repertoire and the target skills components. This assessment informs the development of a tailored task analysis. Subsequently, Data collection on the learner's performance during chaining procedures is crucial for ongoing evaluation and modification of the intervention. This iterative process of assessment, intervention, and data-based adjustment ensures that the chosen procedures are effective and ethically sound. Question 17. When evaluating a supervisory relationship where a supervisor has recently developed a close personal friendship with their supervisee outside of professional contexts, what is the most ethically sound course of action to ensure the integrity of supervision and the welfare of clients? Option A. Continue providing supervision as usual, assuming the personal friendship will not influence professional judgment or the quality of supervision. Option B. Immediately seek consultation with a qualified peer supervisor or a more senior BCBA not involved in the situation to discuss the potential conflict of interest and collaboratively determine the best path forward, documenting all discussions and decisions. Option C. Inform the supervisee that the personal friendship is creating a conflict and immediately terminate the supervisory relationship without further discussion or planning for the supervisee's continued development. Option D. Downplay the significance of the personal friendship and continue supervision, making a conscious effort to be extra objective in feedback and evaluations. The correct answer is B. Immediately seek consultation with a qualified peer supervisor or a more senior BCBA not involved in the situation to discuss the potential conflict of interest and collaboratively determine the best path forward, documenting all discussions and decisions. Explanation. This scenario presents a common ethical challenge in supervision where a supervisor's personal relationship with a supervisee could potentially influence professional judgment and the integrity of the supervisory process. The BCBA Ethical Code, Ethics Code for Behavior Analysts, emphasizes the importance of maintaining professional boundaries and avoiding conflicts of interest that could compromise the welfare of clients or the quality of supervision. The correct approach prioritizes the ethical obligation to ensure objective and effective supervision, free from personal bias. This aligns with the BCBA emphasis on supervisors acting in the best interest of the supervisee's professional development and the clients served. By seeking guidance from a qualified peer or supervisor and documenting the process, the supervisor demonstrates a commitment to ethical practice and risk mitigation. This proactive step ensures that the supervisory relationship remains professional and that any potential conflicts are addressed transparently and appropriately, safeguarding both the supervisee's training and the integrity of the services provided. An incorrect approach would be to continue supervising the individual without addressing the potential conflict of interest. This directly violates the principle of avoiding conflicts of interest and could lead to biased feedback, compromised training, and ultimately, harm to clients if the supervisee's skills are not objectively assessed and developed. Another incorrect approach would be to ignore the personal relationship and assume it will not impact supervision. This demonstrates a lack of awareness of ethical boundaries and the potential for unconscious bias to influence professional decisions. Finally, terminating supervision abruptly without a clear ethical justification or a plan for the supervisee's continued development could be detrimental to the supervisee's progress and may not be the most ethical resolution if the conflict can be managed through appropriate means. Professionals should approach such situations by first recognizing the potential for a conflict of interest. They should then consult the BCBA Ethics Code for Behavior Analysts, specifically sections related to conflicts of interest and supervisory responsibilities. Seeking consultation from a trusted, experienced colleague or supervisor is a crucial step in navigating complex ethical dilemmas. Documenting all steps taken, including consultations and decisions made, is essential for accountability and professional integrity. Question 18. The efficiency study reveals that the behavior analyst has limited direct observation time available for a new client exhibiting disruptive classroom behaviors. To inform the initial intervention plan, which indirect assessment method would best capture the perspectives of the client's teacher and parents regarding the antecedents and consequences of these behaviors? Option A. Reviewing the client's academic records for any mention of behavioral incidents. Option B. Asking the client's peers to complete a survey about the disruptive behaviors. Option C. Conducting a brief, informal chat with the teacher during a parent-teacher conference. Option D. Administering a structured interview to the teacher and a behavior rating scale questionnaire to the parents. The correct answer is D. Administering a structured interview to the teacher and a behavior rating scale questionnaire to the parents. Explanation. This scenario presents a common challenge in applied behavior analysis, gathering comprehensive information about a client's behavior and the factors influencing it when direct observation is not immediately feasible or sufficient. The professional must balance the need for timely intervention with the ethical imperative to gather accurate and relevant data. The challenge lies in selecting the most appropriate indirect assessment method to gain a foundational understanding of the target behavior and its context from the perspective of those most familiar with the client. The correct approach represents best professional practice because it prioritizes obtaining information directly from the individuals who interact with the client most frequently and consistently. This aligns with ethical guidelines that emphasize obtaining information from multiple sources to ensure a comprehensive understanding of the behavior. Interviews and questionnaires, when conducted systematically, allow for the exploration of antecedents, consequences, and the perceived function of the behavior from the stakeholder's viewpoint. This information is crucial for developing hypotheses about the behavior's function and planning subsequent direct assessments. An incorrect approach that relies solely on a single, potentially biased, or incomplete source of information would be professionally unacceptable. For instance, relying exclusively on a brief, unguided conversation with one stakeholder might lead to a superficial understanding, missing critical nuances, or overlooking important contextual factors. This could result in an inaccurate functional hypothesis and an ineffective intervention plan, potentially leading to wasted resources and a failure to adequately support the client. Furthermore, failing to systematically gather information from all relevant stakeholders could be considered a lapse in due diligence and a failure to adhere to best practices in assessment. The professional decision-making process for similar situations should involve a systematic evaluation of available resources, the client's immediate needs, and the ethical requirements for assessment. Professionals should first consider the most efficient and effective methods for gathering initial information. This often involves a tiered approach, starting with indirect methods to form hypotheses, and then proceeding to direct observation and functional analysis to confirm those hypotheses. When selecting indirect methods, professionals should consider the reliability and validity of the chosen tools and the importance of gathering information from all relevant stakeholders to ensure a holistic understanding. Question 19. Compliance review shows that a board-certified behavior analyst, BCBA, is working with a client who exhibits self-injurious behavior. The BCBA needs to collect direct observation data to understand the antecedents and consequences of this behavior to inform intervention planning. However, the BCBA is concerned about the sensitive nature of the behavior and the potential for observer reactivity or the collection of data that could be perceived as judgmental. Which of the following approaches to direct observation data collection would be most ethically and professionally appropriate in this situation? Option A. Directly observe and record the self-injurious behavior using highly descriptive and potentially stigmatizing language to ensure a complete and objective record of the event. Option B. Avoid collecting direct observation data on the self-injurious behavior due to its sensitive nature and focus data collection efforts on other, less challenging behaviors exhibited by the client. Option C. Discreetly observe and record observable antecedents and consequences immediately preceding and following the self-injurious behavior, without explicitly labeling or describing the self-injurious behavior itself in the data sheet. Option D. Rely solely on interviews with the client's caregivers to gather information about the antecedents and consequences of the self-injurious behavior. The correct answer is C. Discreetly observe and record observable antecedents and consequences immediately preceding and following the self-injurious behavior, without explicitly labeling or describing the self-injurious behavior itself in the data sheet. Explanation. Scenario analysis. This scenario presents a common challenge in applied behavior analysis, ensuring data collection methods are both accurate and ethically sound, particularly when observing sensitive behaviors. The professional must balance the need for objective data with the client's right to privacy and dignity. The challenge lies in selecting an observation method that captures the necessary information without unduly intruding on the client or compromising the integrity of the data due to observer bias or reactivity. Correct approach analysis. The correct approach, utilizing a discrete ABC data collection method that focuses on observable antecedents and consequences without directly labeling the behavior itself, represents best professional practice. This aligns with ethical guidelines that prioritize client dignity and minimize potential harm or stigma. By focusing on observable events surrounding the behavior, the BCBA can infer the function of the behavior without explicitly recording potentially judgmental or subjective descriptions of the behavior itself. This method adheres to the principle of collecting objective data while respecting the client's privacy and avoiding undue observer influence. It also supports the development of effective interventions based on functional assessment, a core requirement of ethical and effective practice. Incorrect approaches analysis. One incorrect approach involves directly observing and recording the client's self-injurious behavior using highly descriptive and potentially stigmatizing language. This fails to uphold the ethical principle of client dignity and respect. Such labeling can introduce bias into the data and may cause distress to the client or others who review the records. Furthermore, it may not be the most effective way to understand the function of the behavior, as the focus shifts from the environmental context to the behavior itself. Another incorrect approach is to rely solely on indirect methods, such as interviews with caregivers, to understand the antecedents and consequences of the self-injurious behavior. Indirect methods can be a starting point. They are prone to recall bias and subjective interpretation. Ethical practice and effective intervention require direct, objective observation to validate information and ensure the data accurately reflects the behavior and its environmental context. Relying solely on indirect methods can lead to inaccurate functional assessments and ineffective interventions, potentially violating the duty to provide competent services. A third incorrect approach is to avoid collecting any data on the self-injurious behavior due to its sensitive nature, opting instead to focus on other, less challenging behaviors. This represents a failure to address a critical client need and a dereliction of professional duty. Ethical guidelines mandate that behavior analysts address behaviors that interfere with a client's well-being and learning, and self-injurious behavior falls squarely within this scope. Avoiding data collection on such behaviors prevents the development of necessary interventions and can be considered abandonment of the client's most pressing needs. Professional reasoning. When faced with collecting data on sensitive behaviors, professionals should first consider the least intrusive yet most effective method. This involves a functional assessment process that prioritizes objective observation. The decision-making process should involve 1. Identifying the target behavior and its potential impact. 2. Reviewing ethical codes and legal requirements related to client privacy and data collection. 3. Selecting an observation method that is objective, reliable, and minimizes reactivity and intrusiveness. 4. Training data collectors thoroughly on the chosen method and ethical considerations. 5. Regularly reviewing data for accuracy and making adjustments as needed. The ultimate goal is to gather the information necessary for effective intervention while upholding the highest ethical standards of client care. Question 20. Cost-benefit analysis shows that implementing a simple response interruption and redirection strategy for clients' repetitive vocalizations might yield immediate, albeit temporary, reductions in the target behavior, potentially satisfying a caregiver's immediate request for quiet. However, a comprehensive functional assessment suggests these vocalizations serve a self-stimulatory function and may be a coping mechanism. What is the most ethically and professionally sound course of action? Option A. Proceed with the response interruption and redirection strategy as it offers a clear, immediate benefit and addresses the caregiver's request while monitoring for any adverse effects. Option B. Implement a punishment procedure to quickly suppress the vocalizations, as the caregiver's desire for immediate quiet outweighs the need for a lengthy assessment. Option C. Advise the caregiver that the behavior is likely unchangeable and suggest strategies to ignore it, as intervention might be more effortful than beneficial. Option D. Conduct a thorough functional assessment to understand the purpose of the vocalizations and develop a behavior intervention plan that addresses the function, potentially including replacement behaviors or environmental modifications, even if it means a slower initial reduction in the target behavior. The correct answer is A. Proceed with the response interruption and redirection strategy as it offers a clear, immediate benefit and addresses the caregiver's request while monitoring for any adverse effects. Explanation. This scenario presents a common challenge in behavior analysis where the immediate perceived benefit of a quick fix conflicts with the long-term, ethical, and effective application of behavioral principles. The professional must weigh the client's immediate desire for a solution against the ethical obligation to provide evidence-based, person-centered services that promote lasting behavior change and autonomy. The correct approach prioritizes the client's well-being and autonomy by focusing on understanding the underlying function of the behavior and developing a comprehensive intervention plan. This aligns with the BACP ethical code, specifically the emphasis on beneficence and non-maleficence, acting in the client's best interest and avoiding harm, and the requirement to base interventions on scientific principles and empirical data. It also reflects the principle of least restrictive procedures, ensuring that interventions are not unnecessarily aversive or restrictive. An incorrect approach that focuses solely on suppressing the behavior without understanding its function is ethically problematic. This could lead to a superficial solution that fails to address the root cause, potentially resulting in the behavior re-emerging in a different form or leading to unintended negative consequences for the client. This violates the principle of beneficence by not providing the most effective and lasting solution. Furthermore, it may disregard the client's right to self-determination by imposing a solution without adequate understanding or consent regarding the long-term implications. Another incorrect approach that relies on anecdotal evidence or personal opinion rather than empirical data and established behavioral principles is a direct violation of the ethical requirement to practice within the bounds of one's competence and to use scientifically validated procedures. This can lead to ineffective or even harmful interventions. Professionals should approach such situations by first conducting a thorough functional assessment to understand the antecedents, behavior, and consequences. This data-driven approach informs the development of an intervention plan that is tailored to the individual's needs and the specific environmental context. Ethical decision-making involves a continuous process of evaluating the effectiveness of interventions, seeking client assent and consent, and prioritizing the client's long-term welfare and skill development over short-term expediency.